Welcome. Today we're here with Bethany to share her story. Thanks for being here.
Thank you for having me. It's a pleasure.
So what are we, about a year and a half?
About a year and a half. Yeah, just shy of 2 years. I can't believe here we are. It's unreal.
Great. So tell us a little bit about before the surgery. What was your health like?
Well, I was struggling a lot. About 10 years ago, I had a car accident in which I broke both of my legs. And I was already overweight at the time. And it just I gained more weight and struggled with physical activity just because of the amount of pressure that was already on my body. I was in the pre-diabetic range. I had high blood pressure, just different things. I never felt good. I felt very tired, just in a lot of pain a lot of the time prior to the surgery.
Sure. So what was the thought process like as far as thinking about what your options were for undergoing bariatric surgery?
It was definitely not something I considered at first because I consider, anesthesia and all that is very scary, of course, to consider. And I had tried to lose weight in the past, and I would get to a certain point and just struggle just with the physical activity. I thought if I could just lose this much, I know I could hit the ground running. And actually, it was one of my friends who's a former patient of yours as well, who told me about Atlanta Bariatrics and said, maybe you should consider this, because she had started taking her life back. She had the sleeve, and I was so inspired, and I thought, I want that chance. I don't know if surgery's right for me, but what's a consultation gonna hurt? And obviously that's where our journey started, was that first consultation in which I had read a little bit online about the different types of surgeries, but, through learning more, and obviously the route that we ended up going was the RNY, I started doing obviously more research as we went along, because it was about a year-long process from that first consultation to on the operating table.
Sure, so that was a little longer journey than some people have.
Right.
It's different for everyone. So you had the surgery, you had the gastric bypass. So was it what you expected?
I knew I was going to lose a fair deal of weight. I knew that just with the nutrition visits and everything that you guys had prepped me for, I feel like more preparation that you guys gave me and the tools that you gave me, it gave less room, less gray area for those ambiguities and those fears and all those things to kind of park themselves in the brain, because you all were very forthright, and hey, you try to drink a Gatorade too fast, you chug it in about 20 seconds, you're not gonna be happy with yourself towards it. But so it was very, you all aired me on the side of caution, because not every aspect of this can be exciting and pretty. Sometimes it's tough and it's hard, and you've really got to know that you're making this decision and looking at all sides of it. So it's what I expected, in the fact that I'd hoped to lose the weight. I realized that the weight was just a catalyst for a lot of other things, and learning myself, and which was ultimately what I needed to do in order to take my life back.
So were there any unexpected things?
About the surgery or life or in general?
In general.
I wasn't necessarily prepared to lose as much as I did. I lost a lot, not just weight. I had to let go of people, things, situations that didn't serve me and weren't healthy. But because I was able to find the courage to choose what was healthy, it opened my eyes to be able to point out the other things in my life that weren't healthy to me, that were holding me back, much like the weight. And so it's kind of been this all-encompassing experience. It was just, the weight was just like the initial part of it all. Right. So I wasn't expecting everything in life. I thought, okay, I'll be able to skate, I'll be able to, sit in movie theater seats and not feel digs in my side. I was thinking about those things. but the realities and possibilities that my life, of course, is now open to, I'm blown away. And that's just the beginning. I'm only not even 2 years out. I'm a baby.
Sure.
You know?
So, I think you've seen that, and we stressed this even before surgery, that the surgery itself is just one piece of a much bigger puzzle.
Right. Absolutely.
And so there are a lot of lifestyle changes. There are a lot of things that can be interesting with other people, with relationships, with food, with exercise, of course. And you have a little unique, we always stress, some kind of regular exercise is important. You want to tell us what you do for exercise?
Yes. It was kind of like a bucket list thing for me. I thought as soon as I get this weight off, I'm going to learn how to roller skate. And I'm now part of a roller derby league. I'm a baby and, I'm not quite, Miss Roller Girl Supreme yet, but I'm on roller skates. I'm skating. I'm able to do things like boxing, dancing, other things that I'd only ever dreamed about having the endurance and, to be able to do those things physically. So
that's great. Well, we have a lot of patients doing a lot of different things. You kind of have to start where you are as far as the exercise goes.
Absolutely.
But I would have to say that roller derby, that's a bit unique.
It is.
Good for
you. You definitely have to have some good core and, glute strength to be able to do some of those things and not fall, for sure. So, but it's been a blessing.
So you mentioned the weight loss, and you've actually lost more than you anticipated. How's your health now?
My health, man, all of my blood counts, everything's within normal limits. Any medications that I was on before, I'm not on. I just take my routine vitamins and my chews. Even my little calcium chews, because I'm supplementing with my diet, I don't have to take as much. I'm able to have a more active job now where I do walk a good bit. And I was telling a coworker the other day, I was like, old Bethany, I don't think could have done this. I think old Bethany would have been laying down on the concrete back there. I'm able to not just keep up, but maintain and push myself, which is awesome.
That's great. Well, you mentioned that one of our other patients kind of recommended that you think about this. So if you were talking to someone else who was having weight issues, what would you tell them?
Definitely, read up on it and educate yourself. The internet will have a lot of, stuff to have to sift through. I would recommend, truly looking internally and really deciding for yourself, like, what all do you want to lose? And really think about choosing yourself. And I would encourage, whatever path that is, to, be true to yourself. Because ultimately, that's the only way you're going to succeed, whether it's a surgical option, non-surgical. I know for me, that first consultation, it was more of a confirmation of everything that I was already feeling within myself. And it was just, through affirmation and just the overwhelming amount of support from everyone in the office and every question I've had. It's only ever made me feel better. But certainly if there is that, that question you're thinking about having that surgery, what do you have to lose in that consultation? Go in, have specific questions, bring up your concerns. Don't feel like a concern is too small or, oh, maybe the doctor doesn't care about this or this is silly, because this is what you do. You help, begin that ball and motion for change and transformation to happen. You take all of those factors into consideration. So I think that having, a little bit of faith and being able to choose that for yourself, that's what I would encourage somebody to have. Just have a little bit of faith and, give it a shot. Just, what else? What do you got to lose? just, you know.
Well, that's fantastic. I'm very happy with where you are so far in your journey.
Thank
And
you.
I appreciate you sharing your story with us today.
Thank you so much.